In a converted former factory on an industrial estate in Bridgend, patient numbers in this field hospital are growing. They're aged between 42 and 99. 2 rows of beds per ward, some already full, others taking new patients as we film. All admitted here, recovering from COVID.
Everyone's just trying to pull together and do what they can, and we're just trying to make the best of it. So although it's not ideal to be in a temporary hospital, we're trying to make it as positive an environment as we can to help these patients to recover and regain the strength that they need.
In these 4 wards, there are 36 patients, and another ward is being opened today to admit more. They are coming from acute hospitals, from community hospitals. They're predominantly elderly patients who are here for a spell of rehabilitation before they can go home.
Teaching's not easy.
No, I enjoyed it. I enjoyed teaching. I did enjoy teaching, lovely.
We meet Dorothy Harding, who's 89, being supported in their wellbeing room. What was it like having COVID
now,
for you?
I can't honestly say to you just breathless, no. I just didn't feel well.
How are you feeling now?
Fine.
Have you been well looked after here? Looks like you have.
Absolutely marvellously been looked. Oh yes, they've been wonderful. I don't know who the doctor is, but give him a shake of hand for me. He done a good little job there.
I'll be 100 next May. I never dreamt I'd ever live to this age. Where did they have the virus? When I caught it in Morgan Hospital.
This was supposed to be a step-down unit for non-COVID patients, but so severe have been the hospital outbreaks and infection levels in the community, now it's all former COVID, admitted here only after they've gone past their infectious phase. When are you going home?
I don't know, because I've come here for rehabilitation, but I think I'm going to need far more assistance when I leave.
What are you most looking forward to about going home?
Well, more in a comfort zone. I mean, this is not like an hospital, it's more like a military hospital, isn't it? Because of the circumstances have caused it.
Circumstances which have seen this health board area record more COVID deaths than any other in Wales. Merthyr Tydfil, 20 miles away, has seen a fall in infection rates in recent days, but it remains one of the worst affected areas in the UK. Are you expecting to fill all the beds in this hospital?
Well, we've got the beds here. It's the staff that's the challenge, obviously.
These nurses have been recruited recently from India. Staff sickness levels from COVID across the health board are rising. The GPs, physios, dietitians and chaplains working here are all too aware of the pressures on colleagues in the acute hospitals.
I'm really hoping that we can take this opportunity to just take care of each other and realise that, you know, the NHS is part of the community. So just all appreciating each other and valuing each other. That's my hope. And obviously my fear is my colleagues burning out. That's my biggest fear and what we're all trying to prevent, I suppose.
The firebreak lockdown in Wales will end on Monday, repeated the Health Minister today. Many wait to see what impact it may have had on slowing this latest surge. But in the meantime, next to the vast room with over 100 hospital beds, notably, they are getting ready to install another 60.